pharmacosedation, which includes the use of medications, we have these 4 routes of administration: oral, inhalation, intramuscular, and intravenous. So these are 3 surveys that were published by the ADA in 2008, the Academy of General Dentistry in 2007, and by Goodchild and Donaldson in 2011. And virtually all of the doctors responding to these surveys were general dentists.
Because it all gets down to, how do we get the drug into our body and then start to work on the central nervous system? And the process by which the drugs get there will make a big difference in why you'd want to use one, either oral versus IV when you're working on a patient. The two differences, again, and I think we can see that the IV route is much more efficient. It actually skips through a lot of the processes that would eliminate you having to be absorbed in a certain amount of time, because if you think about some of the things that would affect absorption in your gut, anxiety is certainly one of them, because it affects motility of the digestive tract and also how much food someone's eaten. There's many factors that may come to play on how effective your body may absorb that medication through the gut. So what are the advantages and disadvantages of each route? Well, we can look here that, the onset from oral is 30 to 60 minutes because it has to jump through those hurdles. Where if we jump right into the vascular system, the effects and onset of the drug is 20 to 30 seconds. So it's much faster. Also, because we can administer such minute amounts of medication in the IV at a time, we can do something that's called titration, where we actually can incrementally advance the medication until we get to the desired effect. Where if we do the oral route, we give one, bolus of medication, and we don't really know the outcome, and we can't quickly titrate it because it takes 30 to 60 minutes for it to reach desired effect. Drugs that are used most commonly, we're going to use a benzodiazepine. They've been found, to be very effective and very safe because the therapeutic range is in a safe margin for most of those medications we're using. The benefit for the IV is that we can also use an opioid, which would be good for analgesia, or it can bring down the level of pain and discomfort, but also can synergize with the benzodiazepine and make it a little bit more effective.
There's a lot of variability in the way individual persons respond to drugs. And that's why with oral sedation, I'm going to use the term, it's a crapshoot. Okay, we are making an assumption the first time you give that drug that the patient will respond the way they're supposed to. 15%, as Brady mentioned earlier, it's not going to work. They're still anxious. What are you going to do? Are you going to give a second drug, a second dose of that drug, and wait another hour? In California, you can't do that. But the other 15% are oversedated. And oversedation means you stop what you're doing, and you take care of the problem. It's not black and white. It's a gradual slope downhill.
Titration is the safe way to administer all the sedation medications that we want to use. And that's why the IV is the best route, because it skips all the hurdles right into the bloodstream, right to the brain. We can titrate, and in 30 seconds, we can get an effect. Whenever we look at the effect of oral, it's just too long. 60 minutes is a long time to wait. So you might achieve, the actual goal or end state that you're trying to get to because you were lucky. Maybe you've administered in the past to the patient. And so that would be my suggestion, is maybe if you only do oral, maybe try a dose that Dr. Malamed was saying, which would be a standard dose, and then have them come in for maybe a cleaning where you're actually going to be monitoring the patient during the cleaning, and you can see the effectiveness of the medication. And then that way, when you're doing actual treatment, you can modify the level, because you can make a change to that medication on the next time you see the patient. When it comes to IV, you can do it right there on the fly. And as he said, if you mix inhalation with the IV, that actually helps as well.